Today we are looking at how to manage diabetes with diets and exercise. Diabetes mellitus is a disorder in which the body does not produce enough or respond normally to insulin, causing the blood glucose level to be abnormally high. Urination and tests are increased, and people may lose weight even if they are not trying to. Diabetes damages the nerves and causes the problems with the sense of touch. Diabetes damages blood vessels and increases the risk of heart attack, stroke, chronic kidney disease, and vision loss. Doctors diagnose diabetes by measuring blood sugar. People with diabetes need to follow a healthy diet that is low in refined carbohydrates, including sugar, saturated fat, and processed foods. They also need to exercise, maintain a healthy weight, and usually take medications to lower blood sugar levels. The three main nutrients that make up most of the food are carbohydrates, protein, and fats. Sugars are one of the three types of carbohydrates, along with starch and fiber. There are many types of sugar. Some sugars are simple, others are complex. Table sugar, which is sucrose, is made of two simpler sugars called glucose and fructose. Milk sugar, which is lactose, is made up of glucose and a simple sugar called galactose. So the carbohydrates in starches such as bread, pasta, rice, and similar foods are long chains of different simple sugar molecules. Sucrose, lactose, carbohydrates, and other complex sugars must be broken down into simple sugars by enzymes in the digestive tract before the body can absorb them. Once the body absorbs simple sugars, it usually converts all of them into glucose, which is an important source of fuel for the body. Glucose is the sugar that is transported through the bloodstream and taken up by cells. The body can also make glucose from fats and protein. So blood sugar really means blood glucose. Insulin is a hormone released from the pancreas, an organ behind the stomach that also produces digestive enzymes. This insulin controls the amount of glucose in the blood. Glucose in the bloodstream stimulates the pancreas to produce insulin. Insulin helps glucose to move from the blood into the cells. Once inside the cells, glucose is converted to energy, which is used immediately, or the glucose is stored as fat or the starch glycogen until it is needed. The level of glucose in the blood varies normally throughout the day. They rise after a meal and return to pre-meal levels within 2 hours after eating. Once the level of glucose in the blood returns to pre-meal levels, insulin production decreases. The variation in the blood glucose levels is usually between a narrow range, about 70 to 110 milligram per deciliter, or 3.9 to 6.1 millimoles per liter of blood in healthy people. If people eat a large amount of carbohydrates, the level may increase more. Older people that are older than 65 years tend to have a slightly higher level, especially after eating. If the body does not produce enough insulin to move the glucose into the cells, or if the cells stop responding normally to insulin, it is called insulin resistance. The resulting high levels of glucose in the blood and the inadequate amount of glucose in the cells together produce the symptoms and complications of diabetes. There are many complications of diabetes. We know that diabetes damages blood vessels, causing them to narrow and therefore restrict blood flow. Because the blood vessels throughout the body are affected, people may have many complications of diabetes. Many organs can be affected, particularly the following: brain, causing stroke; eyes, which is diabetic retinopathy, causing blindness; heart, causing heart attack; kidney, diabetic nephropathy, causing chronic kidney disease; nerves, diabetic neuropathy, causing decreased sensation mainly in the legs and feet. High blood glucose level also cause disturbance in the body's immune system. So people with diabetes mellitus are particularly susceptible to bacterial and fungal infections. How do we manage diabetes? How do we keep the sugar under control? We know that normally you do a test, blood glucose screening. So your blood glucose level is screened. So a blood sample is taken after the people have fasted overnight. Diabetes can be diagnosed if fasting blood glucose levels are 126 milligram per deciliter or 7 millimoles per liter or higher. However, it is possible to use blood samples taken after people have eaten. Some elevation of blood glucose level after eating is normal, but even after a meal, the level should not be very high. Diabetes can be diagnosed if a random, not done after fasting blood glucose level is higher than 200 milligram per deciliter, which is 11.1 millimole per deciliter. Now, in the aim to control or better manage diabetes mellitus, there are many factors that are at play. Diet, exercise, weight loss, education. For people living with type 1 diabetes, they will require insulin injections. And for people living with type 2 diabetes, they can take some of their medications by mouth, or sometimes insulin is given. So diet, exercise, and education are the cornerstone of treatment of diabetes and often the first recommendation for people with mild diabetes. Weight loss is important for people who are overweight. People who continue to have elevated blood sugar level despite lifestyle changes or have very high glucose level, and people with type 1 diabetes, no matter their blood glucose level, also require medication. Because complications are less likely to develop if people with diabetes strictly control their blood glucose level. The goal of diabetes treatment is to keep the blood glucose level as close to the normal range as possible. So it is helpful for people with diabetes to carry away medical